Hi guys, it's Dr. Steven Sigalove, board certified plastic surgeon here in Scottsdale, Arizona. So today I thought we would talk about breast augmentation incisions. And I'll start off first by saying there's really no right answer. I think that the best answer is you should have an incision that your plastic surgeon feels comfortable performing. That being said, there are some reasons why I exclusively will try to use the inframammary incision. Now, first of all, there are three main incisions for a primary breast augmentation. Those are inframammary, which is under the breast in the crease of the breast, called the inframammary fold. The other ones are periareolar, which is around the areola, partially. And the third one that is oftentimes used is called an axillary incision, or hidden in the armpit. All three of these incisions have benefits, but they also have some cons. And when you look at all the pros and cons of all those three incisions, I think that it's very clear that the inframammary incision is the best incision. The first reason is that the inframammary incision has the lowest percentage of capsular contracture. And this is a very important concept because a capsular contracture can lead to secondary revisional type surgeries. And it has been shown and linked that capsular contractures are likely due to increased bacterial load within the pocket. The two incisions from the armpit and around the areola all go through the breast tissue, which is really not sterile. Because of this fact, there's a higher incidence of capsular contractures with these two incisions, which is one of the main reasons why I choose to do the inframammary incision. And this is not just me saying this, this is actually proven in the plastic surgery scientific literature. The second reason why I really feel that the inframammary incision is the best incision for a primary breast augmentation is really something that I call pocket control. I feel that I and most plastic surgeons alike can control the dissection of the pocket much better through direct visualization when the inframammary incision is used. If there is bleeding during the process, we can stop the bleeding very simply and very directly through this inframammary incision. Some of the other incisions, I think that they have less control of the pocket, which results once again in increased risk of further reoperation. The axillary incision in particular is notorious for incomplete release or transection of the distal pec insertions. So a lot of the pockets done through the armpit incision tend to be tight. Now, obviously, there are plastic surgeons all over the place who are absolutely amazing and do a wonderful job through all of these incisions, but I'm speaking in general fashion. And in general, the incision under the breast in the inframammary fold has a much better incidence of reduced reoperations. And perhaps the third and final reason why I think that the inframammary incision is the best is the fact that it is really inconspicuous. It literally is in the crease of the breast, so in the upright position, the incision is completely invisible. It's about a 3 to 4 centimeter incision, which is very short, and even if it does heal very poorly, which it rarely does, it's almost not noticeable. Whereas if the periareolar incision, which is on the border of the areola, happens to heal improperly, it is very visible. Obviously, it's in plain sight, and an ugly scar in this area will be very hard to look at. The axillary incision as well, if it happens to heal poorly, it's relatively inconspicuous. The nice part about it is the fact that it's actually not on the breast, which is great. However, there are other negative reasons for not doing it, like capsular contracture, incomplete pocket release, and less control of the pocket, in my opinion. So these are really the main reasons why I believe that the inframammary incision is the safest incision to use. I think that breast augmentation surgery is a fairly straightforward procedure, but we want to keep it safe, we want to keep it reproducible, and with this incision, I rarely have any patients who are not completely thrilled with this incision. So if you have any questions, feel free to message me. You can call the office or just schedule a consultation. I would love to speak with anyone on these topics and others. Thanks and have a great day.